In this video, we're going to be continuing the digestive system notes for lecture, and we're starting at tooth decay. Tooth decay is pretty self-explanatory. It's decay of teeth. What you primarily need to know about it is good dental hygiene can prevent this. So you're supposed to brush your teeth twice a day, floss your teeth twice a day. You can do other things like fluoride rinses or using a mouthwash that can help kill some of the bacteria in your mouth. But one of the more important things that you should do is reduce the amount of sugar that you eat. While sugar does not directly contribute to tooth decay, what happens is the bacteria that live in your mouth will ferment the sugar and then produce acids, and those acids will wear away the enamel of your teeth, and that's what leads to cavities. You're also supposed to go in every 6 months to have a professional clean your teeth. They'll help scrape any of the tartar or plaque from around the gum line off of your teeth. That will help slow down some of that erosion that can happen, so make sure you're getting your regular checkups. A lot of people have this fear of dentists, and I totally get that. It's never fun to sit in that chair and have them turn a drill on and start working in your mouth. However, if you wait until you start to feel pain, the treatment is going to be a lot more time-consuming and difficult than it would have been if you had just been going in for your routine visits. And so just try to make sure you're going in for your routine visits. As unpleasant as that is, it beats a drill in your mouth every day of the week, and so go in for those. In addition, there are some other things that can increase your risk of tooth decay, and that would be smoking and excessive alcohol drinking, and so you also want to try to avoid those. There are genetic components at play here too, and so there are some people who can do everything right and still end up with tooth decay, and that's just because their teeth didn't form correctly as a result of the genetics that were at play. And so there are some things that you can control, and there's some things that you can't. Next up, after tooth decay, we have acid reflux. This is one I've already alluded to. So remember, there's a cardiac sphincter right at the boundary between the esophagus and the stomach. And what that sphincter does is it prevents stomach acid from washing back up into the esophagus. While your stomach can deal with the acid, your esophagus isn't built for it. So if that stomach acid washes up, you'll get literal chemical burns in your esophagus, and that's what leads to that symptom of heartburn, which is characteristic of acid reflux. So the whole thing that defines acid reflux is the failure of that sphincter that's allowing the stomach acid to wash back up. Now, there are foods that can help trigger this, and you want to avoid those foods. And so basically that would be the spicy foods, hence the picture up over there. One of the other treatments that are available to you are these drugs that are called proton pump inhibitors. What these do is they prevent your stomach from making as much acid. However, that does alter how you digest your nutrients, and so these drugs will very often have some side effects associated with them. I was always kind of surprised when they decided to start making these over-the-counter medications, and that's because they do have some pretty serious side effects, and so you really shouldn't be taking them unless a doctor has specifically told you that they recommend it for you. Next, vomiting. Vomiting seems like one of those things that is just an annoyance. However, it can be life-threatening, especially if a person is doing it a lot. Now, this goes back to those chemical burns that I was talking about a second ago. If you're vomiting a lot, all of that stomach acid is coming up and it's damaging the esophagus and it's damaging the mouth and the teeth. And so that's something that you have to look out for if a person is vomiting for an extended period of time, like if they are bulimics. There is also something that's just called hyperemesis that is characteristic of pregnancy that can occur. So most people know that there's morning sickness that's associated with pregnancy. But in some people, it's not just during the first trimester. They will vomit all day, every day, throughout the course of that pregnancy. And not only can that lead to nutritional deficits because they're vomiting up all the food that they're eating, but they can get that tissue damage that I was talking about just a moment ago, and they can suffer from dehydration and electrolyte imbalance, and those two things can kill you. And so this can be a serious life-threatening thing if a person is vomiting a lot. There are drugs that can treat this. There's even some that are topical. You just rub them on your wrist, and that can help you reduce the amount of vomiting that, or at least nausea that you're experiencing. The nausea is basically what comes before the vomiting, that feeling of I'm going to throw up. But the vomiting itself, it's not benign. It is something that can harm you, and so you kind of want to, if you're vomiting a lot, go get medical treatment. Hepatitis is inflammation of the liver. The most common cause of hepatitis is viral infection, like there's hepatitis A, hepatitis B, hepatitis C, there's a bunch of hepatitises. All of those viruses cause inflammation in the liver, which again is what hepatitis actually is. Now, the different types of hepatitis. Hepatitis A is what's known as self-limiting, which means you get it, it sucks, it goes away. You tend to get that type of hepatitis from drinking water that was contaminated or eating food that was contaminated. In some states, in fact, waiters, waitresses, they have to have their hepatitis A vaccine to make sure that they aren't spreading that particular type of hepatitis. That is not a requirement in Texas, but in some other states it is. If you travel to countries where hepatitis A is more common, it's recommended that you get a vaccine for that. That would be a lot of the countries in Central America. Doctors tend to recommend that you get that vaccine, but most people haven't had it in the United States because it's not all that problematic here. There's a vaccine for hepatitis B, and any of you that are younger than me, which I'm old, you've probably had that series of shots. They now give it to babies. They get the first shot immediately after birth, and then there's 2 other shots that come after that, and that's a vaccine that lasts for life. You don't have to get it again once you've had those first 3 shots. Hepatitis C, there's not a vaccine for that currently. It used to be a chronic condition. There are treatments for that now, but you would not believe how crazy expensive those treatments are. So we can cure you if you have tens of thousands of dollars so that you can afford the treatment for that. And I'm not kidding, it's tens of thousands of dollars. Appendicitis is inflammation of the appendix. If you ever experience pain in what is known as your right lower quadrant, which means like just above your right hip, you should probably go to a doctor pretty quickly, especially if that pain is intense, because it tends to mean that the appendix is swollen. If the appendix swells too much, it can burst like an overinflated balloon, and unfortunately when it does that, it flings bacteria out into your entire abdominal cavity. That can lead to sepsis, and that can kill you. And so that's why if you have that pain, you want to go in. They'll remove the appendix. It's a pretty quick surgery. People tend to recover from it fairly quickly. You'll be put on antibiotics just to deal with any infection that would have been leading to the appendicitis or coming from the appendicitis. But if you get the surgery, you'll be fine. If you don't and it bursts, chances of death are actually pretty high. And so you want to make sure if you're feeling that pain, you go see a doctor as soon as possible. Diarrhea. We alluded to this one as we were looking at the Bristol stool chart in the last video, but this of course means you have watery stool, and it also tends to mean that you're having cramping and an urgent need to defecate. Diarrhea tends to come from things like bacterial toxins, or you have a viral infection that's causing the diarrhea. One of the more common causes is in fact a virus called rotavirus. That's another one that there is a vaccine for, because it leads to some pretty nasty diarrhea in young children that can kill them due to dehydration. And so this is, again, another one of those things like vomiting. Everybody thinks it's just an annoyance in the United States, but it kills people every year because they get dehydrated and then their kidneys fail and then they die. And so if a person has prolonged diarrhea, you should definitely seek medical treatment so that you can avoid that dehydration. Constipation is the exact opposite. It's you're having trouble defecating, you're backed up is another way to look at that. One of the more common causes for constipation is a person doesn't get enough fiber in their diet. I teach nutrition as well, and I've graded a lot of food logs in my time, and the vast majority of my students do not get enough fiber in their diet, and that predisposes people to constipation. Constipation increases the risk for hemorrhoids. Hemorrhoids can be anything from that just they're itchy and annoying to they are painful and burning and bleeding, and you have to have surgery to fix those. And so constipation is another one that it's not just annoying. If you're chronically constipated, you want to get medical treatment for that as well. Disturbing picture on the next slide. Colon cancer is cancer of the large intestine or cancer of the colon. I've already talked about this a little bit in the last video when I was talking about colonoscopies. This person, we're doing a colonoscopy, so we've got the camera shoved up the rectum, and then this is the cancer. Not only was this preventing feces from moving past it, and so it was leading to constipation and problems there, but this cancer has already spread into new places, and the person had to have that colostomy that I talked about in the last video. This is his colostomy is actually starting to protrude through the abdomen. It doesn't normally stick out this far, but there would have been a bag attached to this, and this is where he would be defecating from, and you can see the surgical scars that has happened here. So once again, just reminder, get your colonoscopy when you're supposed to, which 50 years old is the current recommendation for when you're supposed to get your first colonoscopy. Once again, disturbing picture on the next slide. Hemorrhoids. Kind of already talked about these. They are swollen blood vessels around the anus, and they are much more likely to occur in people who are chronically constipated. They are also likely to occur in people who have increased abdominal pressure, and that would be people who are obese or people who are pregnant. And so, again, this can be very annoying and itchy, or it can be very painful depending on how bad it is. In the case of this person, this is a pretty bad case of hemorrhoids. We're bleeding. We're going to have to go in surgically and remove that so that the person is not suffering from that blood loss anymore. All right, after that, we got nutrients. What I'm going to recommend that you do is just pause this video and get what you need. You don't have to do the whole entire table, but I've given you calcium, potassium, sodium, fluorine, iodine, and iron on this one, and you're doing the food sources for those nutrients, what's their function, and what happens if you don't get enough of those. So everything on this particular slide is a mineral. So again, elements you can find in the periodic table. You need them to help you do something in the body. For each one, it's a little bit different. Now, most people automatically tie calcium to bone health. And yeah, it's important for that, but I want you guys to notice you need it for your nervous system to work and for your muscle to contract. These two things are going to kill you a lot faster than weak bones are going to kill you. So calcium is not just a bone thing. It's an overall homeostasis thing, and it's very critically important for just your overall health and well-being, not just bone strength. And so I do want to go ahead and stress that one. This is one where about 50% of my students get plenty, and the other 50% aren't getting nearly enough. And so that is going to be problematic, because here's the thing. If you don't get enough calcium in your diet, what's going to happen is your body is going to start to steal it from your bones so that your nervous system and your muscles can continue to do their job. So again, you don't die. But that means your bones are getting weaker every single day, all year, all because you're not getting the calcium that you're supposed to have. And that's going to lead directly to osteoporosis later in life. And so while it might not seem like it's problematic right now, it's going to be if you continue to not get enough calcium. Now, everybody already knows that dairy products are a good source of calcium, but so are dark leafy green vegetables. That would be stuff like kale and spinach and collard greens. So one of the best things that you could do for yourself from a nutritional standpoint is add more dark leafy greens to your diet. Doing that helps you with a bunch of things. Notice those dark leafy greens, they show up in a whole bunch of these different places. They're going to show up on the next table too. They're just a very low calorie source of a bunch of the nutrients that you need during the course of the day. So it's just a good idea to add those in there. I've been pointing at the wrong side again, so y'all didn't see any of that I was pointing to, but hopefully you at least saw it's up here. The other stuff that I tend to like to mention, so fluorine, this is Tarrant County, so you guys probably live in Fort Worth. Their water is fluoridated, and so the chance of you being deficient in that is very, very low. Iodine, we did used to live in a place where we had a bunch of goiter, which is a swollen thyroid gland, which is at the front of the neck. But now we have put iodine and salt, and so we very rarely see iodine deficiencies in people either. Now, iron deficiency is one that we still see a lot of, especially in women, and we see that for two reasons. One, women lose blood every single month during the process of menstruation. And so when you lose blood, you lose iron. So women have to consume more iron because of that blood loss. And yet we're not allowed to eat as many calories or we'll gain weight. And we tend to not eat as many of the food sources that have iron as men do. So women are just more likely to be iron deficient. That leads to symptoms like feeling cold all the time, which we talked about anemia back in the circulatory system. But if you do feel cold all the time or you feel tired a lot, iron deficiency anemia is very often the cause of that. And so you might want to see a doctor if you experience any of those symptoms. Once again, just pause the video so you can get what you need, but just to talk about some of these. Everything on this slide, vitamins. There are more vitamins than this. I just left out all the B vitamins, even though they're critically important for you. They are rarely deficient in Americans because they fortify grains like bread, and cereals, which you guys all know what cereal are. So as long as you're eating some form of flour or corn or something, then you're probably getting all the B vitamins that you need to have. Vitamin C. If you don't get enough vitamin C, you can get scurvy. And I believe that I've already mentioned in this class that college students are increasingly becoming vitamin C deficient because they're not getting all the fresh fruits and vegetables that they need to have. And so just have a glass of orange juice in the morning with breakfast, and that will honestly go a long way towards getting you all the vitamin C that you need. Vitamin A. Vitamin A is a tough one. If you eat anything that's basically orange, like carrots or butternut squash or yams, they are very good sources of vitamin A. Vitamin A is something, though, that you can build up too much of. And so vitamin A is one where you really want to make sure you're getting just enough. You don't want to be deficient because that can lead to night blindness. You also don't want an excess amount because that can also lead to blindness. And so you want to make sure you're doing the Goldilocks thing and you're in the happy middle where you're getting just enough vitamin A, because you can build up toxic levels of vitamins. I want to say I've already alluded to this in another video, but again, I've heard people say if a little is good, a lot must be better. And that's not true when it comes to your vitamins and minerals. You need the right amount, not too little, not too much. You want that Goldilocks zone. Vitamin D. Vitamin D is one that a lot of people are deficient in, and it's because we don't go outside as much as we used to. And here's why outside matters. Let's see if it actually says it up here. It really doesn't. I think I talked about this when I was talking about skin, but if you go spend a little bit of time out in the sunshine, your skin can start the process of converting cholesterol into something called cholecalciferol, which is the precursor to vitamin D. If you don't go outside as much, your skin doesn't do that conversion, and you end up with less vitamin D in your system. You need vitamin D to help you absorb calcium. So if you don't have enough vitamin D, by default, you're not going to have enough calcium in your system. And so that can lead to all those problems that are also associated with not enough calcium in your diet. And so even in the wintertime, when it's cold, if the sun is shining, it's a good idea to go spend a little bit of time outside just to try to make sure you're getting all the vitamin D that you need. However, remember that note that I gave you when we were talking about skin, which is sunlight can also cause skin cancer, so don't do too much. Do enough that you make your vitamin D, but not so much that you're causing skin damage, and you'll know when you damage it because you get a sunburn. Let's see. After that, you have why is fiber beneficial? There are several reasons. So first off, fiber helps keep you regular. So if you're getting the amount of fiber that you're supposed to, you will be having regular bowel movements, and they will be more comfortable bowel movements as a general rule, so you'll help avoid constipation. 2, fiber helps reduce the risk of colon cancer. So the more fiber you get, the less likely you are to get colon cancer. 3, fiber has been shown to reduce cholesterol levels, and Americans tend to have high cholesterol, so having more fiber in your diet can fix that so you don't have to take pills because your cholesterol is too high. So even though fiber is something that your body can't use, it passes through your system because you can't digest it, it still ends up being very helpful because it's doing those things that I just mentioned for you, keeping you regular, reducing your cholesterol, and reducing your risk of colon cancer. How do you get fiber? Fiber is just cellulose. Cellulose is a component of the cell wall of plants, so eat anything from a plant and you'll be getting some fiber in your diet. And that's why this picture is up here. Every single thing in that picture has fiber in it because it's all plant stuff. Now, some of them have more than others. The avocado, not as much fiber as, say, the eggplant is going to have off over here, but they all have some in there, and so have some of those things. Even if it's something that you don't super duper love, it's a good idea to eat it and then just tell yourself you're eating this for your health and well-being, and so eat it. I know a lot of people don't like broccoli, for example, but it's good for you. It has a lot of, again, it's a dark leafy green, so it has a bunch of calcium in it, it has a bunch of iron in it, and it has a bunch of fiber in it. And so it way beats all the symptoms that can end up developing because you're not getting enough of those things. What is obesity? There's different definitions that can be used here. I'm going to use something called the body mass index, which is BMI. If a person has a BMI that is greater than 30, they are clinically defined as being obese. Now, BMIs aren't perfect, but for the average person, it gets you where you want to be. And yes, we can make obese mice as well. So this is an obese mouse. So BMI over 30, it means you are not just overweight, you are overweight to the point where you are medically more likely to develop type 2 diabetes, hypertension, cardiovascular disease, stroke, a whole bunch of other things that can go along with that. So the other thing that I do want you to know about obesity is it shortens your life, it makes you less comfortable, and it puts you at a higher risk of different diseases like type 2 diabetes. So you don't want to be obese for a bunch of reasons. What factors lead to it? Bad diet that has too many calories for you, lack of exercise so you're not burning the calories that you need to be burning to keep the weight off. Now, I will also say there are genetic components to obesity, and there's hormonal factors that are play there. And so you can't always assume that a person who is obese is doing things incorrectly in relation to their health. There was a story, and I wish I had a picture of this, but there was a story several years ago about a little girl who ended up developing obesity because she had had a tumor on her pituitary gland, and during the surgery, they damaged the hypothalamus, and so she became hungry all the time, and she ate all the time, and she ended up becoming obese as a result of that. But it was because they damaged her brain, and her hypothalamus was making her feel like she was hungry all the time, even when she wasn't. So she couldn't help how she was feeling because her brain was literally damaged. And so don't make assumptions about people or treat them poorly if they're obese, because you don't know how they got there. They might have had, like I said, a hormonal problem or a genetics problem that they really had no control over. All right. Anorexia and bulimia. These are both psychological conditions. They are in, what's that thing called? The DSM, the diagnose, I always forget. I think it's the DSM, but I don't remember what it stands for right now. But it's the guide that helps psychologists tell you whether or not you actually have a psychological condition. Like, it's the diagnosis manual for psychology. While both of these are related to psychology and the nervous system, they play a direct role on the digestive system, which is why we're talking about them here. Anorexics often have something called body dysmorphia, which is they will look at themselves in the mirror and they will see a person who is fat or overweight or has a specific part of their body that doesn't look like what they want to. There was an interview ages ago from Portia de Rossi, who suffered from anorexia, and anybody would say she was a beautiful, skinny woman, and yet anytime she looked in the mirror, she would look at her thighs and think they looked fat. As a result, she was starving herself because of the anorexia. Now, there's another component to anorexia that I find particularly fascinating, and that is a fear of food. There are some anorexics out there that, like, if you try to stuff a sandwich in their face because they look super skinny, there was actually an article about this, and the mom was trying to feed the teenage daughter in the car, and the daughter actually opened the car door while they were driving and jumped out of the car because she was that afraid of the sandwich and she didn't want to eat it. And so that also tells you something about how strong the mind is when it comes to anorexics and the fear of food that they can end up developing. It's a very unhealthy relationship, and it's not always about body image. Sometimes it's just about the food, and it's so complicated that they don't understand the food necessarily. And that's kind of what was happening in the case of the girl who tried to jump out of the moving car. Bulimia, instead of just starving themselves, bulimics will very often go through a binge purge cycle where they will eat a whole bunch and then throw it up later on. That is very, very unhealthy because not only are they getting the nutritional disturbances, they are also damaging the esophagus and the mouth, and that's going to lead to many, many health problems. And they are more likely to suffer from electrolyte imbalance that will cause kidney damage, leading to kidney failure. And so bulimia is no joke. P.S. I spelled it wrong on this slide. That should have been an I. But again, psychological condition for the most part that is listed in, I still think it's the DSM. I really need to Google it, but I've got all my screens open at this point. Okay, so after that, I've got some group work, which since we're all working online, we can't really get together and do the group work. So instead of it playing that way, you can kind of consider those challenge questions and see if you can solve those questions on your own. I also have this thing that I have labeled as in-class work. So usually I would have students get together in groups and pick a weight loss method and then provide information on that. I'm not going to do that this semester since we are working online. I'm going to play around with something else instead, and I'm going to make a quiz available for you guys in Socrative, or I'll put it in Blackboard. I haven't really decided yet since this is an asynchronous class. Some students are working a lot faster than others. So I take it back. I'm going to do it in Blackboard instead, but there'll just be a little multiple choice quiz over the digestive system, and that's all you have to do. So just to reiterate, group work is not something you have to turn in or do, but consider those group work questions and pictures things challenges that you can try to make sure you're able to do. And the end class work about the weight loss methods, you can just cross that out. You don't have to worry about it at all. We're not going to be making the presentations. So hopefully that helps you get through the digestive system.